Yeah.
So I'm going to take proper body substance isolation precautions. Everything looks perfectly safe. Patient seems fine. So how are you doing today?
Not that good.
Not that good. What's going on?
Having chest pains.
Alright, and is this simply just the chest pain?
Yes.
Alright, this seems to be a non-trauma case. I don't need a stabilized spine, nor do I need additional EMS, just what is already available here. So, how's your day going so far?
Not that good.
Not that good? Just the chest pain?
Yes.
She seems perfectly responsive. She's in a good mental state. I'm not going to assume that she's experiencing any sort of circulation loss to her brain, so she seems perfectly fine. Alright, and so just keep talking to me about what's going on.
Just having some pain around like my head area.
Just a heart area.
Just yeah.
Alright, so how's your breathing?
Seems normal.
Seems normal. You're getting proper intake, outtake. Excellent. That's fine. Alright, I'm going to check for your pulse, so if you want to just lay your arm right here. Go ahead and uncross your legs for me. Alright, she has a faint radial pulse. Can't really feel much. Her brachial pulse is present. So we're going to actually just deem that oxygen may not be necessary because she seems to be doing fine as far as her pulse goes. Her skin looks perfectly pink, warm to the touch, and dry. So no worries there. There isn't any major bleeding. So we're just going to start taking some history. So when did this start happening?
This morning.
Right, and how has this kind of affected you throughout the day?
Just having pains.
Right, and on a scale from 1 to 10, how severe is it? A 5. So, and when you inhale, is the chest pain radiating anywhere else in your body? No, just your chest. Go ahead and inhale for me one more time. And that's simply just the pressure you're experiencing, which is a 5.
Yes.
Right, okay. So, past medical history, do you have any allergies that could have caused this?
Not that I know.
No, just are you taking any medications? No? Alright, and you said you have no other past history of chest pain?
No.
No? Alright, and it's not radiating, and you said this has been happening since the morning?
Yes.
Alright, so this has been radiating for quite some time, so we want to definitely know what's causing it. Right, seems to be cardiovascularly, pulmonarily fine. She's breathing, her pulse is there, she seems to be fine in a mental state. As far as the other body systems, we don't need to assess them because they're not applicable to the case. So I'm going to go ahead and take your blood pressure. So I'm just going to locate your pulse one more time. Making sure this is closed. Alright, so patient's blood pressure was slightly elevated. We did have a systolic of 125, and we stopped hearing the blood pressure at about 90 degrees. I just want to take one more step to make sure her breathing is fine. Go ahead and inhale for me, please. Alright, so considering her blood pressure and proper ventilation, she seems to be doing fine. This is a non-shock case. her blood pressure does raise some precautions because it is elevated, so we are going to transport her to the hospital. This is going to be non-shock, and it's going to be a low-risk ride, so we are not going to be in level 3 or anything with the lights on, so we're just going to simply take her to the hospital for further assessment.